The head of the CDC says the next 2 months will be critical in determining the future course of the COVID crisis in this country. Joining us now, Dr. Anthony Fauci, the White House Chief Medical Advisor. Doctor, welcome back to Fox News Sunday.
Thank you, Chris. Good to be with you.
I want to start with a pretty impressive number. 3 million vaccinations administered yesterday, Saturday. Not 1 million doses in a day, not 2 million, but 3 million. How did that happen, first of all? And secondly, can we keep up that pace?
You know, Chris, I think not only can we keep up the pace, we might even do better. And that is because the implementation of the program of getting vaccines into people's arms is really accelerating greatly. You know, with the community vaccine centers, pharmacies getting vaccines in, mobile units going out, and getting a lot more people who can actually vaccinate people. Military members, retired physicians, nurses, and healthcare providers. So you're seeing two things simultaneously. A lot more doses available and a greater efficiency in getting it into people's arms. So I'm not surprised at that number. I think we're going to maintain it, and we might even do better.
I want to show our viewers two charts. Let me put them on the screen. First, the 7-day average of new cases, which spiked dramatically in January, is down sharply, but still over 50,000 per day. And second, the number of deaths reported per day, which also is down sharply, but if you look at that horizontal line, is still higher than it was during the very concerning spike last July. So I guess really two questions. Is it too soon to say that we are in the process of beating this virus? And what are the chances that this could still turn around and we could end up with a fourth wave of COVID?
That's the critical question, Chris. And when you see a plateau, we're very pleased by the sharp decline that you've shown. But when you see a plateauing at a level of anywhere between 50 and 65,000 cases a day, that is absolutely no time to declare victory, because we know from previous surges that we've had over the year that when you see that leveling off at a high level, there's always the risk of a surge back up. And in fact, unfortunately, that's exactly what is happening in Europe right now. They had the same kind of decline. They always seem to be a few weeks ahead of us in the dynamics of the outbreak. Then they plateaued because they pulled back a bit. They thought that they were home free, and they weren't. And now they're seeing an increase up. We have to avoid that, Chris. We're going in the right direction. Vaccines, as you mentioned, every day we get more and more people vaccinated, which gets us closer and closer to a better protection. To pull back now prematurely would be ill-advised.
Well, let's follow up on that issue. I'm going to ask you a question straight out. I want a straight answer. Given the tenuous situation we're in, is what Texas did this past week, ending the mask mandate, reopening 100%, is what Texas did dangerous?
I think it's risky and potentially dangerous, yes.
And you say that because?
Well, for the simple reason of what I just explained. If you have a baseline of infection that is quite high, and if you look at the numbers, we are not out of the woods yet. When you pull back on all mitigation methods, on all public health guidelines, that's when you get into trouble. I mean, history has proven that, Chris. This isn't just some kind of a theoretical a point that I'm trying to make. It's not theoretical. It actually happens. Take a look at January, February, March, April, in the late winter, early spring of 2020. Take a look at the summer of 2020. And now look at where we are right now. If you look at those numbers, that plateau bothers me and other public health officials. When you plateau at a high level, there's enough viral activity in the community that when you pull back on things like masking and not pay attention to avoiding congregate settings, it is very risky to get another surge. If you wait just a bit longer to give the vaccine program a chance to increase the protection in the community, then it makes pulling back much less risky. But if you do it prematurely, there really is a danger of triggering another surge.
President Biden set a number of goals for the nation in his speech to the country this week. Let's take a look.
All adults, people 18 and over, eligible to be vaccinated no later than May 1. By July the 4th, there's a good chance you, your families and friends will be able to get together in your backyard or in your neighborhood and have a cookout or a barbecue and celebrate Independence Day.
Doctor, how confident are you that we're going to be able to meet the president's goals? May 1 for eligibility, May 30th for actual access to the vaccines, July 4th for small gatherings. How confident are you we're going to meet all of those? And which of the three do you think is going to be the hardest to meet?
Well, Chris, I'm pretty confident that we are. Those are quite reasonable goals and expectations. The first one about what I was referring a couple of weeks ago on your show about like open season, meaning you don't have to fall into one of the priority categories. You got those taken care of, and now you could open it up to anyone. If you look at the number of vaccines that are going into people now, I think that goal of anybody 18 years of age or older will be able to get a vaccine by May 1st, I think that's quite reasonable. The amount of vaccines that are going to be available by the end of May, clearly that's something that's right on target with the new contracts that have been made with the pharmaceutical companies to get even more doses. If, in fact, we do that, and we vaccinated people at the rate that we just referred to a few minutes ago, I think the 4th of July projection is really quite reasonable. I don't see any stumbling blocks in that. The only thing that's you always have to be careful of is that if, in fact, getting back to our conversation a few moments ago, we don't pay attention to that plateauing and more states essentially pull back all public health measures, we could have a surge back up. And if the surge back up comes, that would endanger the goal of getting people much more towards normal in the beginning of the summer. It's not going to influence the vaccination program or the vaccination rate, but it could influence how soon we get back to normal.
Doctor, let me talk to you about another possible concern. If we were to reach those goals, that pretty soon after that, the problem with vaccines is not going to be supply, it's going to be demand and whether people are willing to actually get the vaccine. I want to put up a public service announcement that 4 of our former U.S. presidents put out this week. Take a look.
So we urge you to get vaccinated when it's available to you.
So roll up your sleeve and do your part.
This is our shot.
Now it's up to you.
Now, conspicuous by his absence in that public service announcement was President Trump, and here's why that was important. According to a recent poll, 49% of Republican men said they don't intend to get the vaccine. Doctor, how much of a difference will it make if President Trump, who was largely responsible for the success of Operation Warp Speed, how much of a difference will it make if President Trump leads a campaign for the people who are most devoted to him to actually go out and get the vaccine?
Chris, I think it would make all the difference in the world. He's a very widely popular person among Republicans. If he came out and said, go and get vaccinated, it's really important for your health, the health of your family, and the health of the country, it seems absolutely inevitable that the vast majority of people who are his close followers would listen to him. He's such a strongly popular person. I cannot imagine that if he comes out that they would not get vaccinated. It would be very helpful to the effort for that to happen. I'm very surprised at the high percentage of Republicans who say they don't want to get vaccinated. I don't understand where that's coming from. This is not a political issue. This is a public health issue. And the history of vaccinology tells us, when you look at smallpox, polio, measles, all the things that vaccines have been so incredibly helpful in getting us out of difficulty with those infections. I just don't get it, Chris, why they don't want to get vaccinated.
Well, let me ask you another question. You know, as we say, President Trump was largely responsible for the fact that we have all these vaccines available now. Why do you think he hasn't spread that message, didn't participate in the PSA, and got the vaccine in private and didn't make it public in January when he was still in the White House.
Yeah. Again, it's puzzling to me. I mean, clearly, Operation Warp Speed started in the Trump administration. It was very successful in getting us the vaccines we have right now. It seems like an intrinsic contradiction, the fact that you had a program that was started during his pregnancy and he's not out telling people to get vaccinated. I wish he would. He has such an incredible influence over people in the Republican Party. It would really be a game changer if he did.
Dr. Fauci, thank you. Thanks for taking the time to talk with us. Always a pleasure. Please come back, sir.
Thank you, Chris. Good to be with you.